Okay, this is an important question. Of the rare disease field is very wider, and probably we need to separate if we are talking about rare disease as a whole problem or rare disease research. Focus on only in the research of rare diseases. To answer to the first possibility to rare disease field, the main questions for me is still the promotion of policies at the regional and governmental level in order to focus the activities in the health promotion of the patient and families, and also social activities, because at the end the lives of the patient and their families is very complicated. If we only look at the problem of the research are different things. We are other kind of people, but the families are suffering, need to face different questions. That is why it is important for the politician to be aware of the problem and to promote research policies in terms of the public health, in terms also in health research, in terms of economic research, health economic research, and social research also. This is as a general problem in terms of the public health. But if you are asking me about the research in rare disease as a whole, probably the response should be different, because at the end, the question of I think the International Rare Disease Research Consortium, main of the two goals are really very valid currently, and the therapeutic areas and diagnostic areas are still both in the same level, the most important areas for research and to promote the research in these areas. Well, the data sharing is a nightmare. It's a complete nightmare. For many years, we have been working together with other people at the European level and also international level for many years, since the late of the 19 years, but the success is not so good, because at the end, to share data is valid or useful in terms of one disease or one group of the disease. And this kind of data sharing is mainly promoted by the researchers involved or the people involved in that disease or group of the disease. But if we are talking about the whole of rare disease, it is very difficult to create a real data sharing. For example, one of the main questions is to share data among governments. It is very difficult to consider that in order to see difference, in order to create policies that can be promoted one area and other area, because there are epidemiological difference and prevalence and other difficulties. There are many studies in cancer, in frequency cancer, not in rare disease cancer, where researchers have shown the situation of the mortality of cancer as an example between the north of Europe and south of Europe. This is impossible to develop this kind of studies in a real way in Europe, which is probably the most advanced continent in the rare disease field, together with the USA and Australia. But it is very difficult to compare countries at the global level. But if we are talking about just the data sharing, for example, in a diagnosis field, and diagnosis rare disease field, we have the possibility to share the data. But at the end, there is a question of ethical, there is a question of different legal consideration between USA and Europe, between Australia and Europe. It is very difficult. Of course, this is a major challenge, and we need to continue working in this area. Well, that survey you mentioned was addressed to so-called low and middle income countries. Well, now I am involved in another area of this type of countries in Latin America and Central America. And the question is that all of these countries, they don't have really a health system very well organized, several structures. I mean, hospital, the major hospital, minor hospital. In some health system organizes so-called national health system. They don't have national health system. But for example, the insurance system is more prevalent in these kind of countries because people that have money prefer to pay for some insurance system, private insurance system, more than the public health system. This is very difficult in order. This affected to the frequency disease also, but at the end, if we go down to the rare diseases, the situation is if we don't have if the country is not very well organized, in terms of the structure, in terms of the facilities, health facilities and research facilities, it's very difficult that the rare disease families can receive good services. This is the major challenge. Therefore, it's a problem for economic, it's a problem for thinking how to develop the problem, it's a problem of lack of knowledge of the problem, but at the end, it's a problem of the internal organization of the country. If the country is not well developed, the situation for the rare disease is very complicated. In fact, in developed countries in Europe, not all countries are the same. Not all countries provide the same services to the whole population affected by rare diseases, which is a mixed problem. It's not only a problem due to lack of money or lack of services. It's a complex problem. I have some criticism with regard this question because, in fact, there is no health research in the field of rare diseases. There are activities, there are some paper published, there are some actions, but there are not really like for diagnosis or like for therapeutic areas. There is not a major focus on health research in the field of rare diseases globally, not only for developed or developing countries. The same problem is in all countries. In fact, we are now working and try to work with in collaboration with the WHO in Latin America in order to stabilize some criteria in order to create some influence among the politicians from the different governmental countries, government of the countries on Latam. This is difficult. There is not a real, there has not been today a real health research in terms of the field of rare diseases. And the criticism I mentioned before is due to, in many cases, this kind of investigation, quoted investigation, has been considered appropriated of the patient organization. Of course, the patient organization has a real role. They have developed during this year many activities, but at the end, methods for health research are very restricted. There is not health research is not a survey. Health research is not to get the opinion of the patients, or to get the situation of the families. This is valid, but not they are not accomplices with the real criteria for methods in health research. This is one of the major problems because most of the money for health research has been oriented to the surveys developed by the patient organization, instead by the scientists, instead by experts in health economics, experts in public health. This is the major risk. And this has been clear in Europe because in USA there is no health research, only private research, but no health research as a whole. There are in therapeutic and diagnosis, etc., but they don't have the concept, the health research. You don't have an infection or you don't have an epidemic. In the case of the Europe, the concept exists, but the orientation has not been the correct, from my point of view. Well, the major problem with the publishings, publisher and the journals, depending on the publisher, has been the cost of the publication. The cost of publication are still high, even though the cost of the publication in this journal is not the most or the higher in the across of the journals. But the idea is, for example, if we have some data and we don't have money to publish this data, this is a major problem. I don't know how to solve this because I know that to sustain a journal is not free of charge. You need money, you need editorial team, you need to publish the maquetation. There are some activities that they need money. But this is one of the questions. With regard to the orientation, of course, the balances of the private money to support the activities of the journal and the conflict of interest has been discussed for many, many years. But at the end, we need to look for some solution because otherwise, a small team will never publish in the journals. They will have a fantastic data in the case of the rare disease, because in the rare disease we need to don't forget that the rare disease there are two spectrums of the rare disease: the more prevalence diseases and the isolated cases. Isolated cases in many situations, the expert is one physician, two physicians, and they don't have money because they don't have project. They don't have, the government can support for these activities, but they have the real experts for those diseases because there are no more patients, and then they need to collaborate with others, external experts. But it is very difficult. The future orientation, of course, I think that the activities of the journal has been very well conducted. Congratulations. And probably there is no, because at the end, the journal depends on the paper submitted. It is very difficult. You can open windows for other kind of activities in terms to receive more and more articles to be analyzed and published if they have some kind of level. But it is very difficult at the end to attract people, particularly in some areas. For example, in health research, how to attract people for health research, how to attract people for articles that measure the impact, the real impact, following methods, strict methods in the life of the patient, in the quality of life of the patient and their families. This is an area. It is my area of work. That's why I support that. But there, of course, therapeutic and diagnosis are still the most important areas for many, many families.